families. Welcome to your study insured insurance orientation for the Langley School District. Before we get started, I thought we'd take a moment to express our deep appreciation for all the incredible work that you do as homestay providers, whether you're new to the program or experienced. Your role here is absolutely vital in creating a welcoming and supportive environment for our international students. It comes with a lot of responsibilities and hard work, as you know, from helping them to adjust to a new country to ensuring they feel at home. Your efforts make a tremendous difference in their experience and success here. So, Study Insured and Langley School District, we are committed to supporting you and ensuring you have everything you need to set up the students for success. We want to make sure we're here to assist in any way we can to make this experience as positive and smooth as possible for both you and the students. So we'll just get started here. Just quickly talking about health insurance basics. Langley School District has arranged private insurance on the students' behalf through Study Insured. That way they don't have to pay out of pocket for any emergency medical care. Now, students staying 6 months or longer will have access to BC's Provincial Healthcare Plan, MSP. It takes 3 months to get the MSP card, and once it arrives in the mail, make sure the student keeps the card with them at all times. However, within the first couple of months, to fill the gap between them arriving and MSP, they will have access to Study Insured's private and health insurance. They'll have a wallet card that will come with the confirmation package. Within the wallet card, just make sure to keep the card with the student and with yourselves at all times. It'll be a proof of coverage. It includes the student's policy number, effective and expiry dates, and the contact number to our assistance team, which I will touch on in just a moment. Langley School District has already enrolled all students into the program, so no action is required for any of you homestay families. Students will receive the confirmation package in their email. If they have arrived and they haven't received their confirmation email, you are more than welcome to contact Langley School District's international team. That way they can prioritize that for you. Within the confirmation package, there are a couple of attachments to keep in mind of. One is the full policy wording, the Comprehensive Plus plan. The second one is the claim form. You can also find that online, but it's also in the email. Third one is the how-to guide for virtual health service, a great resource to have, especially when there are challenges in providing a family doctor for the student or preventing long-hour waits at walk-in clinics or hospitals. Great resource to have. Fourth one is the how-to guide for the student portal, a portal where you can submit claims and view claim statuses. So I want to show you how to register in just a few moments. And last but not least, the wallet card. Again, proof of coverage for private health insurance. So the Comprehensive Plus plan is the plan that we enrolled all students into the program, and it's designed to cover unexpected illnesses or injuries. So hopefully once they've arrived in your care, they're healthy and ready to tackle their international student journey. Of course, if they do get sick or they get injured, we're here to support them on the front lines. The plan can be used anywhere worldwide except for the home country. It is supported 24 hours a day, 7 days a week by our multilingual assistance team. The Study Insured plan covers medical care such as clinic and hospital visits, emergency dental care, paramedical services, psychiatric, psychological care, emergency prescription drugs, emergency transportation, and repatriation. If they live with a chronic or pre-existing condition, emergencies related to their pre-existing condition are covered. However, this is a private health insurance plan, so with that comes limitations and exclusions. For example, routine care is not covered. Routine care for pre-existing conditions is not covered. What that means is any tests or checkups or medications that are required to manage a pre-existing condition will not be covered. Routine dental care isn't covered. Some benefits have dollar limits, such as an eye exam. So please review the full policy wording or at least a summary of benefits just to get an idea of what is not covered for the student. Important services. Please scan the QR code. I will take a moment for all of you here to just make sure you have that QR code added on your phones. It leads to the contact number to our assistance team, as well as our online website. So you're welcome to pause this video and just scan it. Who is the assistance team? They are your go-to contact for any questions about the plan that the students are enrolled on, questions about how to submit a claim, where can I find the closest healthcare facility near me, whether that's a pharmacy or a walk-in clinic, anything related to healthcare. Please reach out to them. Any questions or concerns, they are the ones to help support you as we go through the year. For more information, we have our online website, www.studyinsured.com/studyinglangley. You'll find all the downloadable documents, such as the full policy wording, claim form, summary of benefits. It comes in multiple languages. Here, you can also access the student or member portal to submit claims. We have our how-to guides and resources. It's a great place to visit. And the time comes that a student needs to seek medical treatment, we offer connections to both in-person and virtual appointments. So when the time comes, you can click on the hyperlink. In doing so, you'd be led to a page where you can sign up for virtual health. Why virtual health? Well, again, as I mentioned, where there are struggles to find a family doctor, or when there are a lot of minor illnesses where you feel like the student doesn't have to wait hours at the clinic or healthcare facility, this saves an incredible amount of time, and it saves money. It's completely cost-free to set up a video call with a doctor. The doctor can provide the emergency prescription at the local pharmacy, and they can provide requisitions for lab work if needed. So within the first week or two, please scan that QR code. Again, you can pause this video to do so and help register the student for virtual health. If they're below the age of 14, make sure you help them sign up on their behalf. If they're over the age of 14, they can sign up independently. Just give them a friendly reminder, or you can still help them if needed. On that same page, if you scroll down, you can explore the mapping tool. This is in the case where you do need to have the student visit a healthcare facility in person. It's a great mapping tool. You put in the policy number, click search, you'll have the map. Look for the facility near you. If it says direct pay yes, that means the student or the homestay family has to pay out of pocket. The bill will be directly sent to us, Study Insured, and we'll take care of the invoice for you. So this is a great way to explore which facility has direct pay with us. And of course, if it doesn't say direct pay yes, they will have to pay out of pocket. But if they're eligible for coverage, they can submit a claim. Important note, make sure that if there is any serious illness or injury that the student undergoes, that you contact the assistance team within 48 hours. Otherwise, eligible benefits will only be paid up to 80%. That means the student may have to pay the other 20%. It can be very expensive, so please make sure you have scanned that QR code that includes the assistance team number. I also have it here, 1-866-883-9787. When it comes to making a claim, we try to make it as simple as possible. We do need basic information such as the policy number, contact information, dates of service, reason for the medical appointment, all that good stuff. And we do need proof of payments if anything was paid out of pocket. We do provide different types of reimbursements, such as electronic transfer to the bank account, check to your address, or wire transfer if needed. And of course, if you do need help submitting a claim, we do have our assistance team at your disposal. How do you submit a claim? Well, you can get started on the website, www.studyinsured.com/studyinlangley. Click on Are You a Student? Register now and access your student portal. Click here. This is also something I would recommend you doing for the student within the first week or two, is to remind them or help them register for the student portal. All they need is their policy number, again found on the wallet card, the last name, and date of birth. Once an account is made, they can log into the student portal and get started by clicking in the block that says Submit a Claim. And you would complete the required information, very straightforward and user-friendly. Once the claim is submitted, the student is welcome to view the claim status in the block that says Claim Status. They can view the explanation of benefits, which will either indicate whether the claim has been approved or denied, or they may require more information in which you can follow the instructions. At the end of the day, there are two ways to submit a claim. One is online through the student portal. All you need to do is get started at studyinsured.com/studyinlangley, or if you're a little bit more old-fashioned, you can put the details in the body of the claim, in the body of the email to studentclaims@studyinsured.com, and make sure you attach all supporting documents. One last thing I want to touch on is the Stay Healthy at School program, which is part of the mental health support we have for our international students here at Langley School District. We find that mental health is just important as physical health, and mental health is an overall part of our well-being. Right? Some days the students may feel happy, some days they may not feel like themselves, whether that's cultural shocks coming into Canada, homesickness, having trouble making friends or family, or just struggling to make the grades. Right? We want to make sure that they're well supported, and we have the Stay Healthy at School program at their disposal as well. What it is that we offer a 24/7 phone line for the students. It comes in over 100 languages. It's cost-free to the students to use, and very simple to verify. They only need to provide their name and the school that they're calling from, and this is a great program to have. It does offer support for personal or school-related issues. Most importantly, it's confidential, voluntary, and accessible, so that way they are able to express themselves in a safe space. The Stay Healthy at School program not only offers phone support, but also video call or structured counseling. The people that are supporting the students are experienced counselors with over 5 years in clinical experience. So they're getting professional help. Online and mobile access, we do have our website, ca.helpwhereyouare.com. Put in the company code SHAS, that stands for Stay Healthy at School. And there they can access resources to not only improving mental health, but also improving physical health. We also have our app, I Connect You. So the QR code, you can pause the video for a moment. The QR code does lead to the app, I Connect You, where students can easily access the mental health support at their fingertips. They can easily make a call or book online consultations. At the end of the day, we just want to make sure that the student is well supported on all fronts. So having this number and having that number will definitely make a difference, especially if the student is needing mental health support. So don't hesitate to advise the student to contact SHAS, Stay Healthy at School, at 1-833-646-1524. And again, thank you so much for your time and for your ongoing commitment and the exceptional care that I know you will all provide. We look forward to working closely with you and continuing to support each other in this important role. Thank you. Bye-bye.